You are most welcome, ladies and gentlemen, for the continuation of today's Tuesday night anatomy with Daniel Opan. We could not finish with the first part regarding the cranial nerve nuclei and columns. And therefore, there's a second part to quickly finish off from where the transmission, ended. So my friends, just sit back and let's finish this one quickly. Yes, so I got to the point where I was explaining why, yes, we are having the nucleus ambiguous, okay, which is in, of course, the medulla oblongata, is in what we call the special visceral efferent column. Okay, that was what we were having. And I was telling you that, yes, although, yes, we talked about the pharyngeal arches, okay, I talked about the various nerves. We said the pharyngeal arch number 1, okay, the muscles that will be supplying, yes, with facial expression muscles, they will be supplied by, of course, the mandibular nerve. We said pharyngeal arch 2, okay, those muscles by way of the facial expression muscles, generally, yes, they will be supplied by, of course, the facial nerve, which is the 7th cranial nerve. We talked about the muscles of the palate, muscles of the pharynx, and of course larynx, collectively supplied by, of course, the glossopharyngeal nerve, the 9th nerve, the vagus nerve, that's the 10th nerve, by way of the superior laryngeal and of course the recurrent laryngeal nerves. But why is it that in this same nucleus ambiguous, we're still having what we call the 11th, okay, cranial nerve, which precisely I'm looking at the cranial accessory portion of the 11th nerve being part of it. And the reason is simple. This nerve, yes, although it supplies essentially, it's going to supply what we call muscles of, give some supply to muscles of the palate and the pharynx, but not larynx, my friends, not larynx, because larynx, yes, will be supplied by, of course, the recurrent laryngeal nerve of what we call the vagus nerve. But the credit usually goes to that of the vagus nerve because that kind of plexus, which we call it the pharyngeal plexus, yes, mainly we talk about, yes, the vagus nerve supplying it. But if my friends, if you take a closer look at what is happening over here, you see that this is, of course, the nucleus ambiguous, the cranial most portion. Yes, that will be for the glossopharyngeal nerve. Then at the middle over here, we have that of the vagus nerve. And then at the caudal region, we have what we call the nucleus for cranial accessory nerve. My friends, you know that accessory nerve is having two components, having two roots. We have this the cranial roots, and this is the spinal portion, where it's coming from, of course, C1 all the way to C5. Ventral, segment of the spinal cord. That's what we find over here, ventral horn. Okay, at the end of the day, yes, it will have to ascend through, of course, the foramen magnum to come and meet the fibers coming from the cranial accessory portion. So that at the end of the day, both fibers, okay, will leave, okay, the cranial cavity through what we call the foramen, jugular foramen. My friends, it's not only this accessory nerve which leaves is the only nerve which leaves the cranial cavity via the jugular foramen, but also this guy over here, which we are calling it the vagus nerve. And that is why the cranial fibers, the fibers that came through the cranial portion, okay, the cranial accessory portion, okay, which also we may call it what the internal rami, because at the end of the day, after exiting through this foramen, jugular foramen, yeah, the fibers will separate, okay, that portion which will be going to supply the peripheral component, okay, the sternal rami, okay, will be going to supply, of course, the trapezius and, of course, the sternocleidomastoid. Very important, inform those boundaries in the posterior triangle of the neck. That's what they are going to do. But how about the the cranial accessory? The cranial accessory component, where is the internal ramus, okay, will join that of the vagus nerve, and it will go on, of course, supply that of what we call mainly going to supply that of the palate, some portion of the palate, muscles over there, as well as most importantly that of the pharynx. But it is doing so via the vagus nerve, and that is why this complex is known as the vago accessory complex, VAC, vago accessory complex. Or what we can say is that mainly the muscles of the pharynx, they are supplied by, of course, the cranial accessory nerve via the vagus nerve, which otherwise you may also call this plexus the pharyngeal plexus. Okay, so that is one thing that I want you to know over here. My friends, there's one important thing that I want to show you over here, that this guy over here, okay, is showing a presentation, something we call pseudo-bulbar paralysis. Okay, now usually this form of bulbar paralysis, yes, it's not a complete form, okay, because for the complete form, then there will have to be involvement of the tongue muscles as well, okay, so that there's that kind of deviation of the tongue. But one thing that we find over here is that, yes, importantly, if there is that kind of injury to this nucleus over here, which is the nucleus ambiguous, then it will lead to this kind of ipsilateral, okay, so one-sided. So you can see that there's that kind of ptosis, some kind of lazy eye over here, that kind of, look at the lip, yes, there will be difficulty in that kind of, speech. These muscles will become paralyzed, okay, to one side, okay. That is that form of bulbar paralysis we are talking about. That is injury to the nucleus ambiguous. My friends, whenever this nucleus ambiguous gets injured, we know the nerves that will be involved, okay, the 9th nerve, the 10th nerve, and of course the 11th nerve. Now precisely, I'm looking at the 9th and then the 10th nerves, okay, the cranial most portion. Okay, whenever there's that kind of injury to this nucleus ambiguous, then what will happen is that it may lead to something we call loss of gag reflex. Yes, so whenever you have a question that, yes, which nerves, okay, are relevant in gag reflex, my friends, go for 9th nerve alongside the 10th nerve. Okay, so that is, one thing that I want you to know over here. Now, the other thing that I want to also touch regarding this cranial nerve nuclei and columns, okay, we've already talked about it, okay, is this guy over here, which is in the general, okay, somatic afferent column. This one, general somatic afferent. I told you that the general sensation from the face, yes, will be carried by this nerve, which we call it the trigeminal nerve, and therefore the nucleus, okay, that will be, and the general somatic afferent column will be, of course, the trigeminal nerve nuclei. Okay, now we are talking about nuclei, my friends. It's nuclei we are talking about. Now generally, if they ask you that the trigeminal nerve, how many nuclei are present, my friend, your answer should be 4. Okay, now I've seen situations where people will choose 3. No, if you choose 3, we are looking at the GSA only. Okay, but I'm talking about there's another one, okay, one motor nucleus. And if you remember the motor one that we mentioned, that was in the special visceral efferent column, where I told you that is in the pharyngeal arch component, because I told you that muscles of mastication will also, okay, be supplied by for the mandibular division of the trigeminal nerve, okay. And that is why whenever you are asked that how many nuclei are in the trigeminal nerve nuclei, your answer should go with 4. But if you talk about the sensory component, then there are 3. And why are we saying there are 3? Yes, one thing is that in the GSA column, there's this big this big guy over here, which we are calling it the sensory nuclei of the trigeminal nerve. And the first portion, which is in the midbrain only, okay, is this guy over here, which we are calling it mesencephalic nucleus, the one we mentioned, mesencephalic nucleus. And then the one which is a bit dilated is in the pons over here, which we are calling it the principal or the main or the chief sensory nucleus. And then as I go in the medulla oblongata till the level of the C2 vertebral level, then what will happen is that I'm going to have the spinal nucleus of the sensory component of the trigeminal nerve. Okay, so please get to know that. Now, because they are different in these regions and different structures, then they will perform different functions. So for instance, the mesencephalic nucleus that we find in the midbrain over here will receive proprioceptive fibers, okay, from the face. Okay, so for instance, if there's that kind of proprioception coming from the olfactory division of the trigeminal nerve, it will be carried by it. If it's coming from the maxillary division, if it's coming from the mandibular division, they will all go into this, this guy over here, which we are calling the mesencephalic, nucleus. However, if the sensation has to do with touch and some bit of pressure, then my friends, it has to come in this, it has to be received in this portion of the nuclei that we find over here, which is in the pons. This is the principal sensory nucleus that we find over here. Then the next one, if I go in the medulla oblongata till the C2 vertebral level, I have the spinal nucleus. My friend, the spinal nucleus is relevant in receiving what we call pain and temperature. Okay, so that is one thing that we find. Now, there was one question that I found some time ago, and the question was that, yes, which of the following sensations, okay, is received by what we call this spinal nucleus? And my friends, yes, the answer that you saw, yeah, there was pain, there was temperature, there was touch, there was proprioception. So which one are you going to choose? Now, my friends, yes, proprioception is out because it's in the mesencephalic only. It will be receiving the mesencephalic nucleus only. But my friend, if I get over here, okay, in the principal sensory, which we said touch and some bit of pressure, what happens is that even the cranial most portion of the spinal nucleus, okay, because it's closely related to this principal sensory nucleus, then it may also be receiving some of the fibers, okay, responsible for what we call that kind of touch and some bit of pressure. Okay, so please let's try and understand these ones for you. Now, one other thing too that I want to show you over here is in this mesencephalic nucleus only, my friends. This mesencephalic nucleus, let me show you. That mesencephalic nucleus that we find over here, okay, which you saw it in the midbrain, okay, is relevant in what we call something we call the jaw jerk reflex. Okay, it's the one which of course can be tested, okay, to check the integrity of this kind of trigeminal nerve. That's the fifth cranial nerve. Okay, so that what will happen is that if you give that kind of stroke over here, okay, in the mandible region over here, then what will happen is that there will be that kind of fibers, okay. So what will happen is that there should be that kind of sensation, okay, received. So please look at this. It has to be carried all the way down. This is the sensory component, the one in blue. This is the mesencephalic nucleus. I'm looking at the cranial portion. There's that kind of pseudo neuron, unipolar neuron over here, or simply unipolar neuron over here. Okay, so because this is a cell body, it's in the mesencephalic nucleus, okay, that we find over here. Now it goes and relates, okay, that one is medial, okay, to what we call, now over here we have that kind of motor nucleus of the trigeminal nerve. I told you that yes, apart from the sensory nucleus, which we are going to have what we call the mesencephalic nucleus, we are going to have the principal sensory nucleus, and then we are going to have what we call the spinal nucleus at the level of the the principal sensory nucleus, yes, but medial to it, we are going to have the motor nucleus of the trigeminal nerve. So what will happen is that yes, the sensation, yes, through this, this what's the name? This neuron that we find over here, which is known as the unipolar neuron, because there is a cell body in the mesencephalic nucleus and it's having this kind of extension. There's a single extension leaving that one, and therefore it becomes a unipolar neuron, but it is relaying outside this mesencephalic nucleus, coming in what we call the motor nucleus of the trigeminal nerve, and from there the efferent will travel all the way to the masseter muscle, and that is why this this jaw jerk reflex can also be called the masseteric reflex. Okay, so that there is that kind of contraction in what we call the masseter. Okay, so one thing that I want you to know is that this jaw reflex or this masseteric reflex is a stretch reflex, okay, that we find, which we use it to test a patient's trigeminal nerve status. Okay, and that is an important thing that I want you to know. Okay, now one other thing that I want to show you, okay, is that this type of reflex is a deep tendon reflex. Okay, that's one thing I want you to know. It's an example of deep tendon reflex, just like the patellar tendon reflex. Okay, once the deep tendon reflex, we want it to happen very fast. These reflexes, they are life saving, and therefore we want to protect the subject from further excruciating pain or injury, and that is why you should go through a very short pathway where is the reflex arc, and that is why you don't need a lot of synapses. Okay, it will just synapse or relay in what we call this motor nucleus of the trigeminal nerve only, so that the efferent, yes, it will travel through this nerve to cause, of course, this masseter muscle to, of course, contract. Okay, which is of course going to be a branch of what we call the the mandibular nerve. Okay, so that is one thing I want you to know. Now, therefore, we say that this is an example of a monosynaptic stretch reflex. Okay, this jaw reflex, it is monosynapse, so there's a single synapse that we find over here. Now, apart from that, because it's monosynaptic, we also see that yes, there are only pseudo unipolar neuron that we find over here. Okay, so that is one thing that I want you to know. Now, this is a very important statement that we are making, that in the CNS, it is the only portion in the CNS that we find pseudo unipolar neuron. Okay, so that is one thing over here. So where is the pseudo unipolar neuron located? It is located in this nucleus that we find over here, which is of course the mesencephalic nucleus. So if we are asked that which areas, yes, peripheral nervous system, we have other ones over there, but as far as the CNS is concerned, the only place in the CNS where we find this guy over here, who is a pseudo unipolar neuron, yes, is this mesencephalic neuron. mesencephalic nucleus, which of course I'm saying is going to relay in this motor nucleus of what we call the trigeminal nerve. Then from there, the efferent will travel all the way to, of course, the masseter muscle, okay, to cause that contraction to take place. Okay, so that is, one important thing that I want you to know. Now, one other thing that we want to use this reflex to do is to help distinguish, okay, an upper cervical cause compression from lesions that are above the foramen. Talk about foramen magnum. Okay, so that's one other function that we are going to use it for. Say that one thing that we want to also say is that an increased jaw jerk reflex, okay, my friends, is characteristic of supranuclear involvement of the motor portion of the trigeminal nerve. So please, my friends, that is one thing I want you to understand over here. Now, my friends, I talked about one nucleus, which was the only nucleus in the GSA SVA group that I mentioned. Now, remember when we were looking at putting those groups in there, I told you that you should put general visceral afferent and special visceral afferent together. Okay, that is what we explained, my friends. This this GVA SVA column, then one thing that we have to know is that there's a single nucleus over there, and that's why the nucleus, we gave it the name nucleus of Tractus serratorius. And the N over there was telling us that yes, related to the 9th nerve, T for the 10th nerve, S for the 7th nerve. My friends, I will explain these ones with you. Okay, we explain all these nerves, which nuclei they are supposed to be under, and we justify why they are so. So please just pay attention for this first presentation that we are doing. We look at all the other ones, okay, as well for you. Now, my friends, I told you that yes, under SSA column, which I'll be getting to, okay, if I talk about the nerves, okay, which are under the SSA, I mentioned something that the retina, yes, was a nerve, okay, like the retina by way of talking about the optic nerve, okay, for vision, okay, will be under SSA. Only that it's not having a nucleus, okay, that's what we said. Okay, but I also told you that in the next one that I'll be showing you, which of course will be the vestibulocochlear nerve, yes, is going to have its nucleus, so that will be under SSA. But my friends, this time around, what I want to show you is that this guy, which I told you that SVA, which was special visceral afferent, the only thing that we put under that area was taste. Okay, that's what we said. Because the various nerves, okay, by way of the 7th nerve through the quarter tympani, yes, by way of course the 9th nerve, the vagus nerve, they are all, okay, helping in some taste sensation, carrying some taste from various regions. But if you look at the olfactory nerve, these nerves, these fila olfactoria that we find over here, yes, although they are endodermal in origin, no problem, it's viscera, but the only thing is that as far as if you are saying the nerves, okay, then what will happen is that this one will be under SVA. Okay, the olfactory nerve will be under SVA. But because you don't have a nucleus for it, the only one that I want you to place under SVA, which we've discussed already, will be, of course, that of taste. Okay, so please get to understand this one. Yes, the next thing that we also look at, I told you under SSA, special somatic afferent, is carrying special sensation, but from what we call the somatic structures. And one, because the reason is that the only one that we put over there will be, of course, the auditory pathway by way of, the hearing and balancing. And that's why we said the nuclei that will be present over there will be, of course, the vestibular nuclei and, of course, the cochlear nuclei, okay, will be the only ones present there. Why? Because they are derived from what we call the internal ear, and internal ear will be derived from what we call the otic capsule. And otic capsule, my friend, it is endodermal. Sorry, it is what we call ectodermal in origin. So please try and understand these ones. My friends, in summary, what have we done in the first part and the second part that we've looked at? We said that yes, we are going to have neural tube. A neural tube will have to open up, okay, to accommodate the fourth ventricle. If it's a spinal cord, yes, the central canal will be there, no problem. But in the in the brain stem, we are going to have what we call the fourth ventricle captured over there, and that's why it has to open up. And once it opens up, then what will happen is that with the help of the sulcus terminalis, okay, sulcus limitans, you're able to divide this opened plate, okay, into two. such that we have what we call the basal plates, okay, and the basal plate is going to be motor, and we have what we call the alar plate, which is going to be sensory, okay. Then what will happen is that we are going to have the various columns, and within the columns we will have various nuclei. And what did we say? From medial to lateral, we are going to have what we call the motor nuclei, yes, more closer to the midline. And that's why if you look at those nuclei in the fourth ventricle, the floor of the fourth ventricle, we'll be seeing such phenomenon over there. So when we get there, we try and appreciate why we have those motor nuclei more towards the midline, because that was how the neural tube opened, so that the sensory component, yes, by way of the alar plate, they go a bit laterally. And so from medial to lateral, okay, we are going to have this one, which is the general somatic efferent. And my friend, I told that the general somatic efferent, yes, it will be supplying skeletal muscles, but skeletal muscles derived from somites. And we say somites, we are talking about those tongue muscles alongside extraocular muscles. That's what we mentioned. Then we go to the next one, okay, which we have the what do you call it, special visceral efferent. And if we say special visceral, although it's a misnomer, we are talking about the pharyngeal arches, the bronchial efferent. Okay, that's what we find. And whenever we talk about muscles of pharyngeal arches, we say, first pharyngeal arch will be supplied by mandibular nerve. Yes, second pharyngeal arch by, of course, the second pharyngeal arch be supplied by, of course, that's the muscles of facial expression. The muscles over there be supplied by that of the facial nerve. The third, fourth, and of course the sixth pharyngeal arches, the fifth one disappears, will be supplied by, of course, the glossopharyngeal nerve, by the vagus nerve, and by, of course, by what we call the, yes, by those ones. The vagus nerve, we talk about the laryngeal nerve, and of course the recurrent laryngeal nerve. That's what we see. Okay, they will be supplying muscles of the palate, muscles of the pharynx, and muscles of the larynx. Okay, that's what we see. That's the brachial efferent. And then moving away from that, okay, we have what we call the general visceral efferent, the GVE column. And my friends, one thing that I told you is that this GVE column, the key thing over there is that it's a parasympathetic column. And that's why we talk about the nerves, we talk about the third nerve, yes, through what we call the Adinga vesical nucleus. Okay, we talk about the seventh nerve, yes, by way of, going to the nuclei, going to supply, of course, talk about the, the lacrimal gland. We talk about the submandibular sublingual glands. Okay, we'll be supplying these ones. Then we talk about that of the ninth nerve by way of supplying the parotid gland. Okay, and of course we talk about the other nerves, which will be so through the superior salivatory nucleus and the inferior salivatory nucleus, the seventh and the ninth nerves will be supplying these nerves, these glands and smooth muscles over there. Then we talk about that of the 10th nerve, okay, through the vagus nerve. Okay, the nucleus is the dorsal nucleus, dorsal motor nucleus of the vagus nerve. Okay, so that is what we see. And those ones, yes, will be supplying the smooth muscles and glands. Okay, that's what we saw. And then that is why we got to know that the parasympathetic nerves were the third nerve, the seventh nerve, the ninth nerve, and of course the 10th nerve. That's what we saw. Now we said that for the afferent group, instead of having 3, we are going to have 4 columns, and the first 3 columns just a mirror image of what we found in the efferent group. And so the first one that we're going to see is the general visceral afferent. Whenever we are looking at the afferent group, try to forget about the efferent group, okay, so that it get concentrated, because if you try to put them together, you may get confused. So the general sensation coming from, of course, viscera. Okay, and we have defined the viscera as internal organs derived from endoderm. Okay, so that is one thing that we want to see. For instance, the tension of the stomach, yes, stretching of the stomach, pain, touch, pressure, all those ones coming from viscera. Okay, that's the general sensations. And then we also have the next one, which is of course the special visceral afferent. And then we say that the special visceral afferent, the only thing that we want to put over here will be taste. Okay, yes, special viscera, for instance, the tongue, okay, helping to taste the temperature of, let's say, coffee or some kind of food. Okay, so that is one thing that we have to know. Then the next one, yes, will be of course the general somatic afferent. General somatic afferent. And my friend, the general somatic afferent, that will be the general sensation coming from the body wall. And I told that in the head region, the only one that the nerve that you should put in mind will be the trigeminal nerve. Okay, that's what we're talking about. And then the last one, which is very important, a special one, okay, will be what we call the special Okay, special somatic afferent, and my friend, the special somatic afferent, the SSA, as far as cranial nerve nuclei, okay, the column we are talking about facial nerve nuclei are concerned, then think of what you call the vestibulocochlear nerve nuclei. Okay, they are the only ones that I want you to know over here. All right, I hope you find this meeting helpful. Please share with friends if you enjoyed it. Have a good night, all of you, and may the good Lord richly bless you. Amen.